Good afternoon. This is the 2-minute warning. Please press 1 to ask a question.
Good afternoon, everybody, and thank you for joining today's update on COVID-19 in North Carolina. As of today, we have had 863,409 cases, 1,239 new cases reported since yesterday, 1,353 people in the hospital, and sadly, 11,288 people who have died. Even as North Carolina battles its way out of this pandemic, we know that people are still sick and sadly still dying from this disease, and our prayers are with them. But I am pleased to report that North Carolina's COVID-19 numbers have declined and remained stable. Last week, we took careful, deliberate action to ease but not lift some of the strict restrictions to move our economy forward while at the same time still protecting public health. And that means we must continue working to keep ourselves and each other safe by wearing a mask and social distancing. These simple measures are still our best tools for slowing the spread of this virus until more people are vaccinated. The State Department of Health and Human Services, our providers, continue to work extremely hard to get people vaccinated in a way that's fast and fair. Our work's getting noticed. Last week, the Kaiser Family Foundation released a report showing North Carolina as the #1 state in the nation for vaccinating people 65 and up. As of today, more than 60% of our seniors have received a vaccine. And there's more good news. The Johnson & Johnson one-shot vaccine is now authorized and will be here this week in North Carolina. It's a real advantage that this is only one shot and more easily stored. And it's been shown to be very effective in preventing hospitalization and death due to COVID-19. We expect to receive 80,000 doses beginning tomorrow. Our constant request for more vaccines has been answered. The federal government is standing up a FEMA-supported vaccination site in Greensboro to open March the 10th. It'll be open 12 hours a day, 7 days a week, and will provide up to 3,000 vaccinations a day for 8 weeks, with additional community sites and mobile vaccination clinics in Guilford and surrounding counties to reach underserved communities. Our state and local emergency management teams are hard at work getting the site ready, and we are working hard with FEMA. That's the kind of partnership we welcome and expect in this fight against the pandemic. Given the current rate of vaccinations and increased supply, many providers say they can move to the next phase of vaccinations. So I'm announcing today that all frontline essential workers in Group 3 will be eligible to receive the vaccine starting tomorrow, March the 3rd. This includes first responders and emergency personnel, such as police, firefighters, rescue workers, people who are working in manufacturing, food and agriculture, grocery stores, government workers, and our clergy, among others. Our essential frontline workers have remained on the job throughout this pandemic, and I'm grateful for their work. We're also announcing that some members of Group 4 will be eligible beginning March 24th. We'll open Group 4 first to people with medical conditions that put them at a higher risk for severe COVID-19 illness. The third vaccine and improving vaccine supply for the two we already are getting will help us get more people vaccinated more quickly. But as I've said before, we still don't have enough vaccine. You may have to wait for an appointment, even if today's action means that you're eligible to get vaccinated. People are eager to get vaccinated and still have to wait and plan for when it's time and their turn to get your shot. We've been able to move this quickly because of the great work of the people of North Carolina, the dedication shown by doctors, nurses, pharmacists, and others, including our DHHS staff and local health departments across the state. The patience shown by people eager to get their shot. The trusted voices who are setting good examples and encouraging and helping others. This has come together to make vaccine administration in North Carolina fast and fair. We're pleased to see all of the educators step forward for vaccines over the past week. It's good to see more school systems getting students back in person into the classroom, as we've urged. School systems that haven't set dates to return are being pushed to get children and educators into the classroom. Learning in person is critically important to students. And I look forward this week to more action to make sure that that happens in a safe way. With declining and stabilizing COVID data, a new vaccine, a new FEMA site in our state, recent increases in total vaccine supply, and the easing of restrictions, there are many reasons to feel hopeful. However, even when we continue to move in the right direction, we know that progress is fragile. New COVID variants are in our state, and vaccines aren't widely available yet. We all must continue to wear our masks and use good judgment. If we recommit to keeping ourselves and each other safe, we can save lives and get to the other side of this pandemic. Also with me today is our Secretary of Health and Human Services, Dr. Mandy Cohen, our Secretary of Public Safety, Eric Hooks, our Director of Emergency Management, Mike Sprayberry, and Commissioner of Prisons, Todd Ishii. Monica McGee and Lee Williamson are our sign language interpreters, and behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. I'll now recognize Dr. Cohen for a few remarks. Dr. Cohen.
Well, thank you, Governor. This is a really exciting moment. This weekend, the federal government authorized the Johnson & Johnson one-shot vaccine. And we now have 3 tested, safe, and effective COVID-19 vaccines that are keeping people out of the hospital, keeping them from dying from this virus. A third COVID-19 vaccine means North Carolina can get more people vaccinated sooner and meet our goal to provide equitable access to vaccines in every community across this state. Later this week, as the governor said, we expect to get more than 80,000 doses of Johnson & Johnson vaccine, and we'll be getting 215,000 first doses of the Moderna and the Pfizer vaccines, bringing our state's allocation to almost 300,000 first doses for this week. Additionally, we'll have 160,000 second doses arriving. Busy week. In addition, our state allocation from the federal government is also providing more vaccines through our federal pharmacy program with Walgreens, the FEMA site in Greensboro that the governor discussed, and the federal program with our federally qualified health centers. This is all positive news. While vaccine supplies are still far below what we need to vaccinate everyone, they are improving. Therefore, as the governor noted, all frontline essential workers will be eligible for vaccine starting tomorrow. Our frontline essential workers have been at their jobs throughout this pandemic, making sure we could buy food, keeping us safe, and providing vital services that we all rely upon. Let's take a moment to watch a new PSA featuring these often unsung heroes talking about how and when they plan to get their shot.
Since the start of this pandemic, we responded to nearly 8,000 calls. So that's 8,000 opportunities to contract the virus, and that's also additional 8,000 opportunities to spread the virus.
We have to make sure that our community feels safe, not only by us protecting them, but showing them that we have confidence in the science.
When we talk about us or officers serving and protecting, how better can we show that we're willing to do that than to get a vaccine to ensure the safety of the community we serve.
I decided to take my shot to encourage other people to take theirs. It allows me to be able to go into work and feel like it won't be me next.
We want to make sure that people can get their food, can get their medicine, diapers, milk, all the things that they have to have.
Everybody's got to do their part. If you're not going to get the vaccine, you're just not using your head. And the vaccine is going to save lives.
I lost my dad a week ago from COVID. I don't want anybody else to go through that pain. You're saving not just you, you're saving family members, you're saving other people you don't even know.
We do have a sense of responsibility to the children, to our community, to our families. It's no other way. This is really the only way to push us forward.
You have a spot?
Take your shot.
You have a spot?
Take your shot.
You have a spot.
Take your shot.
You have a spot. Take your shot.
I hope you will share this video along with other resources that you can find at yourspot.yourshot.nc.gov. We need your help in the media in giving North Carolinians accurate information about COVID-19 vaccine. As we look ahead and expect our vaccine supply to continue to improve, we will plan to move to Group 4 on March the 24th. We will begin Group 4 with people who have a medical condition that puts them at higher risk for serious illness, as well as those living in certain congregate settings who have not yet been vaccinated. We've also made some clarification to the groups that I want to go through. First, for Group 1, the definition of long-term care has been updated to include people receiving long-term home care for more than 30 days. This includes home and community-based services for persons with intellectual and developmental disability, private duty nursing, personal care services, home health, and hospice. In addition, for Group 4, we've clarified that higher risk medical conditions include intellectual and developmental disabilities such as Down syndrome and neurologic conditions such as dementia. All of these updates will be on our website, yourspot.yourshot.nc.gov. The top line message is that frontline essential workers are eligible for vaccines starting tomorrow. All current eligibility groups, healthcare workers, our long-term care staff and residents, and people 65 and older, as well as childcare and school staff, will continue to be vaccinated as well. Remember that some vaccines providers may not be ready to open to all frontline essential workers on March 3rd if they're still experiencing high demand for vaccines from those current groups. To slow the spread of COVID-19 and save lives, please continue to practice the 3 Ws, wearing that mask, waiting 6 feet apart, and washing your hands until most people have a spot to take their shot. Thank you, Governor.
Thanks, Dr. Cohen. We continue to appreciate your strong leadership in this area. We'll now take questions from the media. If you could identify yourself and your organization, we'll take the first question.
Our first question is from Ken Lemon with WSOC.
Governor Ken Lemon, WSOC TV. I did want to ask one question in regards to the homeless. And the question is, did we miss an opportunity when we have who are most often transient in a community, have least opportunity to control their own health, and these individuals who are not vaccinated in these areas?
We are deeply concerned about the homeless population, and we are anyway. But when COVID came, we know that people who live in congregate settings have a higher risk of getting and transmitting COVID. We saw that in nursing homes, in prisons, and in the homeless population. I know that our department has worked very hard to provide services for them, to find quarantine support for them. I'll let Dr. Cohen talk a little bit about some of the specific things that are happening out there, but we know that this is a societal issue that we have to tackle together with affordable housing, with mental health services. This is a great time to talk about it, expanding Medicaid to people who are working and aren't making enough money to be able to qualify for federal benefits under the Affordable Care Act. But I'll let Dr. Cohen talk a little bit more about some of the services that our department is providing.
Hi, Ken. Specifically related to those who are homeless in terms of their access to vaccines, there are a number of ways folks may have already gotten vaccinated. Obviously, anyone who is 65 and up who may be homeless is already eligible for a vaccine, as well as those who are the workers who work in our homeless shelters, are frontline essential workers, and as of tomorrow will be eligible for vaccine. And as I mentioned, we're going to be moving to Group 4 on March the 24th. And as I mentioned, we're going to be starting with those who are at higher risk because of their medical conditions, but also in certain congregate settings. And that would include making sure that we're able to get vaccine to our homeless population as well. As the governor mentioned, this has been an area of focus for us throughout this pandemic. As the governor mentioned, whether it was making sure that folks had a place to isolate or quarantine, making sure there was wraparound supports, not just access to testing and a place to isolate, but making sure that they were getting access to the services they need. So has been an important population we've focused on throughout this pandemic. Thank you.
Next question, please.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn with the News and Observer. Is the Johnson & Johnson supply going to be a consistent amount week to week? And with the new timeline for those that are eligible for vaccines, is this a goal or a guarantee given the number of people that are in those groups?
So we're going to get 80,000 of the Johnson & Johnson this week, but no, there is no guarantee of a consistent supply. And in fact, we expect a dip in supply of Johnson & Johnson. We were on a call with the White House today. Then that is supposed to ramp back up. But I think, and I'll let Dr. Cohen expound on this, but I do think that because of the Johnson & Johnson, we also got told today that we were going to receive an even greater supply of Pfizer and Moderna. With all of that together, I think the department feels pretty confident that we'll be able to stick to these dates for being able to open even more groups for vaccines. But I'll let Dr. Cohen address that specifically.
Hi, Dawn. So yes, we plan to get about 80,000 doses starting this week. It'll start tomorrow and Thursday. They'll be arriving Wednesday and Thursday of this week. We've already been told that we will receive no additional doses for next week. So we are giving our vaccinating providers a little more time to make sure that they can get those 80,000 doses out over the next week and a half before we will see the next round of Johnson & Johnson come to our state. We do expect over the course of March to see a lower amount of Johnson & Johnson. We know next week will be 0. We think that the week after will be a very low number as well. But as the governor mentioned, we've heard that it is forecasted that by the last week of March, first week of April, that we should be seeing a pickup in the number of Johnson & Johnson vaccines, and expect they expect to have even more than 80,000 doses per week after that point. So we're appreciative of our vaccine providers that this week we did a special request to them to say who is ready for the 1-dose vaccines. And there were providers all across the state who we're going to be in 33 counties with a Johnson & Johnson vaccine this week at 43 different events. And so it will be widely available across the state starting this Wednesday and Thursday as they come into our state. And as the governor said, because of that, we can commit to the time frame that we are talking about today. So starting tomorrow, all frontline essential workers will be eligible for vaccine, and we will be able to move as soon as March 24th to Group 4. We will start Group 4 with those who are at higher risk for COVID because of some underlying medical conditions and certain congregate settings. Thank you.
Next question, please.
We have a follow-up. Dawn Vaughn, News and Observer.
Hi, thanks for the follow-up. With all these vaccinations coming this month, is there a percent or a population number that will mean that people can look for the next restrictions lifting? With the current executive order expiring at the end of March and this next group at the end of March, what can people plan for as far as when things will change?
We're going to continue to look at the same data that we've always looked at. The number of cases we have, the percent positive, the number of people in the hospital. Those are the data that we are going to continue to examine. And we already see that these vaccinations are likely having a positive effect on this number. We aren't close to herd immunity yet, but we do know that with people who have already contracted COVID, that there is probably some residual immunity. You still have to be very careful, wear a mask, social distance, can't rely on anything. But we think a combination of people getting vaccinated, more and more of them, and the general limited immunity that may be in the population, then that's a reason for optimism. I don't think we can put any kind of specific number on how many people to be vaccinated before further restrictions are eased. We're going to continue to look at the same number and the same data, and hopefully as we move along, we can continue to ease restrictions. What can also contribute to that is people being responsible and careful, because people will have more opportunities to gather. We need to keep masking and keep social distancing. And by the way, congratulations on being elected head of the Capitol Press Corps. Next question, please.
Our next question is from Colin Browder with WRAL.
Good afternoon, Governor. Colin Browder, WRAL. So by expanding throughout Group 3 here, it includes elected officials. Do you plan now to get your vaccination? And will you shop for a vaccine that has a higher efficacy, or would you be happy to get the J&J?
I'm happy to get any vaccine right now. And yes, I probably will get a vaccine very soon. Don't have a specific time yet, but I think it's important for us to get everybody vaccinated. And the great thing about all three of the vaccines that are out there is all of them are very effective in preventing serious illness and death. And there are a lot of advantages to having just one shot. So I think it's exciting that we have all three of these vaccines now. And I'm sure that a lot of other government workers are going to get vaccinated soon as well. Next question, please.
Our next question is from Francis Weller with WECT.
Good afternoon, Governor Cooper and Dr. Cohen. Hope you're both doing well. Francis Weller with WECT. My question is really for clarity for our viewers. With the addition of this new vaccine by Johnson & Johnson, it will be put into the mix with the other vaccines and administered based on availability, correct? And here's why I'm asking. We have heard concerns from some of our viewers who say they would rather get the Pfizer or Moderna vaccine because of the better efficacy. But that's really not an option, correct?
I'll let Dr. Cohen address that specifically.
Hi, Francis. I think the important thing for folks to know is we have 3 vaccines that are safe and effective, and we want folks to get vaccinated as soon as possible. We want folks to know what they are getting. It is important for them to know, are they getting the 1-shot vaccine, or do they need to go to 2 separate appointments? So when folks are signing up for the vaccine, we're working with our vaccine providers to make sure that they are being very clear about whether or not this is a 1-dose vaccine clinic or a 2-dose vaccine clinic. The way we are allocating the 80,000 Johnson & Johnson vaccines across our state for this week and next week is we asked our providers who is ready to do additional events over and beyond what you were planning for the 2-dose vaccine, who's ready to do one of these 1-dose vaccine events. And as I mentioned, there many providers raised their hand. We're going to be in 33 counties, 43 events. So you're going to see Johnson & Johnson in a number of places. Then as I mentioned, we're going to see a bit of a lull in the Johnson & Johnson vaccine coming into our state over the next number of weeks. But then by the end of March, it's really going to pick up again. I think that's going to give our providers an opportunity to make sure that they're working out their operations for the 2-dose clinics, the 1-dose clinic. I think the important folks is for folks to know which one they're signing up for, so they know whether or not to come back for a second dose. But as I said, these are 3 very safe and effective vaccines, and I will say I plan to get the Johnson & Johnson vaccine later this week. These are safe and effective vaccines. I'm glad to be a frontline essential worker and have access to these vaccines in this week, and I encourage everyone to, when it is their spot in line, to get their shot. Thanks.
Next question, please.
Our next question is from Laura Lee with Carolina Public Press.
Good afternoon, Governor. Laura Lee with Carolina Public Press. I'm just wondering, of the approximately 1.5 million first doses that have been administered in the state, how many of those are Group 1? How many are Group 2? And is that something you all are tracking? And I guess at this point, potentially even Group 3. Is that something you're tracking with CVMS?
Hi, Laura. I think we have contours of that that you could probably go right now on our dashboard. As you know, Group 2 are largely those who are 65 and up. So you can
this subgroup of high-risk medical, will that subgroup go first on March 24th, or will March 24th open all of Group 4 up?
I'm going to let Dr. Cohen answer that question, but I'll take this opportunity to congratulate our department for CVMS. That's one of the few states that built our own data system from the ground up, which gives us very granular information about race, ethnicity, and it was recently recognized as the top state for having almost 100% of the data that you need. This allows us to see a problem so we can tackle it, particularly when it comes to equity. And almost every state in the country had problems with that early, as did we. But our information told us that we had a problem with equity, and there was a lot of strong intentional work to make sure that not only are we getting these vaccines off the shelf and into arms quickly, but we're also doing it equitably. And we want those arms to look like the people of North Carolina, and I'm proud of that. But I'll let Dr. Cohen address that question specifically.
Hi, Laura. We do track which groups that folks are in through CVMS. And so your other question was on March 24th, we will open group 4 in phases, similar to what we did with group 3. So we will start with those with underlying medical conditions that put them at higher risk for severe illness from COVID. That list of medical conditions is on our website. As I mentioned, we are updating it to make sure that we are being intentional about including it for those with intellectual and developmental disabilities such as Downs, neurological diseases such as dementia. So you'll see that update on our website this afternoon. But we will be starting with those who are in the part of group 4 that have underlying medical conditions and certain congregate settings. Thank you.
Next question, please.
Our next question is from Rose Hoban with North Carolina Health News.
Hi, it turns out this is a little bit of a follow-on question from Laura's question. What do we know about people with disabilities in North Carolina and COVID? Like some states like California have been doing separate counts to get a sense as to what's happening with those folks. Have we been counting cases among people with disabilities, and what do we know about how they've been affected by the pandemic here?
Hi, Rose. So we don't collect medical information within the CVMS system. We do collect race, ethnicity data that we were just talking about, but we do not collect medical status. We know that as we move forward to group 4, obviously we are going to have folks who are self-identifying as those with a chronic disease that might put them at higher risk for COVID, but that is not going to be medical information we capture within our system. What I can say in terms of our response effort for those with intellectual and developmental disabilities, I think this is where, particularly when they live in more congregate settings, where we spend a lot of time making sure we were protecting folks proactively. And there's a lot we've done to make sure that those congregate settings were as safe as possible. As we've gone through our vaccination efforts, those with intellectual and developmental disabilities have been being vaccinated throughout this process. Many of them do live in group homes or other settings. They're already eligible for vaccination. As I was mentioning in my opening remarks, we're also expanding the definition of long-term care to make sure that it's including those who get long-term home care, which will also make sure that those with intellectual and developmental disabilities are captured in our vaccinating efforts. So I want to make sure that folks know that we've been being particularly attentive to our intellectual and developmental community. We hear from their advocates as they are very close partners of ours as we do our work, and we're going to continue to work with them closely. Thank you.
Next question, please.
We have a follow-up, Rose Hoban, North Carolina Health News.
Hi, I just want to sort of explore this issue a little bit more. There was an analysis done by researchers from Johns Hopkins University back in November that showed that during the pandemic, people with developmental disorders, developmental disabilities and intellectual disabilities had among the highest rates of mortality. They had mortality rates that were even higher than people with Alzheimer's, people with cancer, people with heart failure. So I'm just wondering why it's taken so long to focus on them in the vaccination campaign.
Thanks, Rose. As you know, we've moved through vaccinations in a couple of ways. We want to make sure that we were capturing those who are at highest risk because of their medical status or their age, or at highest risk because of their exposure. For those particularly who live in long-term care settings, which a number of folks in our intellectual and developmental community do live in, like group homes, they were part of our first group of folks who were vaccinated. As I mentioned today, we are expanding our definition of what we're considering long-term care to include long-term care at home more than 30 days. And we are being explicit to your point that we do see that an underlying developmental issue like Down syndrome is put someone at higher risk. So we are clarifying that in our guidance for those in group 4. So you'll see both of that being recognized in our guidance going forward. Thank you.
Next question, please.
Our next question is from Richard Craver with the Winston-Salem Journal.
Hello, Governor. This is Richard Craver from the Winston-Salem Journal. I was just going to get you to maybe elaborate a little further about the decision to accelerate from March 10th to March 3rd. Was there any one issue that was the tipping point in convincing you to do it, given the availability of Johnson & Johnson perhaps quicker than people had thought, or just the nature of the metrics going down?
So obviously these recommendations come from Dr. Cohen and the whole vaccine team. They are in constant communication with our providers of vaccine. And we were hearing more and more from a number of providers that they were ready to go to this category, that they still had people in these other categories, but they were having big events and they wanted to just make sure that they were using all the vaccine that they had as quickly as possible. So they were ready to roll. And there were enough of providers who had been talking to our team here to make them decide that we really need to go ahead and allow those providers who are ready to go ahead with group 3 and move all of this up. Now, some parts of the state, some providers aren't going to be ready to move to group 3. And we want to make sure that a lot of people who live in these areas understand that it may not be group 3 for your area or your provider that you're planning to see. But it's calculated on part of the team. They want to make sure that we're getting these vaccines out quickly. And that's why this decision was made. Anything to add to that, Dr. Cohen? Okay. Next question, please.
Our next question is from Sam Walker with Outer Banks Today.
Director Sprayberry, you were in Dare County on Friday and have been touring some other clinics around the state, getting set for the Greensboro event. Can you tell us what you learned from Dare County specifically and what you learned in doing those other tours? And for Dr. Cohen, we've been able to repurpose some of these television PSAs for use on radio, and just wanted to see if we might be seeing some radio PSAs with regards to the vaccination efforts. Thanks.
I'm going to recognize Director Sprayberry, but he's already given me his report on his trip to Morehead City. So I'll call on him and then Secretary Cohen. Mike Sprayberry, our Director of Emergency Management.
Thank you, Governor, and thank you for your leadership. Thanks for the question. Yes, sir, I did go out to Dare County on Friday to take a look at their vaccination site. As you know, we're going to be opening up a major vaccination site in Greensboro next week. I thought it'd be a good idea to go out and see some sites that we have heard that are being run very efficiently, to see if I could pick up a few best practices and tips so that we could integrate them into our operation. So went down to Dare County, and in fact, that's what I saw, a very efficient operation. A lot of volunteers, a lot of representatives from all of the county agencies working together, and the attitude was phenomenal, not just from the people that were doing the helping, but also the folks that were getting their vaccines. And so a wonderful time I had there with everybody. Got to see the county manager and the local health director. Same thing happened today in Morehead City. Got there early. Another wonderfully efficient operation. People were moving in very quickly and moving out quickly. And so all of this across the state is happening, and great visits. Very excited to be there, and thank you for asking me the question, and hats off to the folks in Carteret County and Dare County. Great job. One team, one mission, one family. Thank you, sir.
Hi, Sam. Thank you so much for using the public service announcements that were made for TV and repurposing for radio. I know we are doing a number of ways in which we're trying to get the message out. So we'll make sure that our communication teams reach out to you specifically so you can understand all the resources and make sure we're purposing whatever you need to get the message out. So thanks for that partnership.
And Sam, Mike told me about his Dare County trip too. Next question, please.
Our final question today is from Paige Perosa with WBTV.
Hi there. Thanks for taking my question. There's a clarification question for two things. When it comes to grocery store workers, will that include smaller markets, smaller company stores, not the big box grocery stores? And then two, will bar and tavern employees be included in the restaurant worker group, or will they wait until group 4 and group 5?
Paige, thanks for the question. So the first thing to know about Group 3 and our frontline essential workers, these are folks that cannot be home to do their job. So yes, there are broad categories of folks, but we are really asking folks to think hard. Are you someone who needs to do their job in person? You're coming into contact with customers, or are you someone who can be working remotely? Because if you are able to work remotely, we'd ask for you to wait for Group 4 or beyond. So for those who need to do their work in person, yes, whether a big store or a small store, you're interacting with the public, yes, eligible to be in group 3. And then yes, and as far as restaurant, bar, they all are included in that same category of food and beverage service workers. But again, wanting to make sure, are you going into work and doing that job in person? If so, then you would be in the appropriate category. Thank you.
Thanks, everybody. We appreciate you being with us today. Stay safe out there.